Sometimes it seems as though pain and aging go hand in hand. Arthritis, nerve pain in the back or neck, migraine headaches, it all adds up to chronic pain. According to the National Institutes of Health, 30% of older adults report having chronic pain. And it's one of the most common reasons adults over 65 seek medical care. So, can we do anything to control or even prevent it? Let's find out more about coping with chronic pain. Well, thank you, Dr. Schnapp, for being on The Best Times, talking about chronic pain.
Thanks for having me.
Let's begin with a definition. What is chronic pain?
Chronic pain, we used to say any pain that lasted for 6 months or longer. But reality is it depends on the intensity of the pain. If you have a mild headache for 6 months, not a big problem. If you have shingles pain or sciatica, it doesn't take many days of suffering before it starts changing your life.
Well, what causes chronic pain?
Oh, there are so many things. Remember, any part of your body can hurt except the brain, which is interesting. But you can have pain coming from just about anywhere. Common for most of us as we get older, joint pain, osteoarthritis, and other arthritis like rheumatoid. But nerve damage becomes common. Diabetes can cause what we call neuropathies with burning pain in the feet. Sciatica is common when people have ruptured disc. So there are a number of pains. I would say that in my practice, there are at least 24 main pains that we see at least every day.
Well, and that made me think, obviously chronic pain affects your physical health. Can it also affect your mental health?
Absolutely. And one of the reasons is the mental attitude. If you have chronic pain, it can lead to depression, anxiety, panic attacks. It can really change a person who is productive and amiable into somebody who's irritated all the time, depressed. Lack of sleep will also do it. We need to sleep, and pain is frequently a major factor for insomnia.
Well, as a pain specialist, how do you go about treating chronic pain?
The first thing is to have a proper diagnosis. So people with pain, they should see first their primary care physician. And I would say the vast majority of pains can be treated by the primary care. When that does not suffice, then we are there. And because of our field of expertise, we are more likely to see pathologies that the primary care may see once a year, I may get to see every day. So more experience helps. And the first item here is to come up with a proper diagnosis. You don't want to start treating things you don't understand. So you come up with a proper name, and then you do therapeutic trials. Trials go from medication, sometimes simple, sometimes complex. Pain specialists often do interventional pain management. That can mean nerve blocks or sometimes burning of the nerves in certain areas. More complex treatments such as spinal cord stimulators, which is like a fancy pacemaker introduced into the spine to alleviate pain. So we have a whole gamut of things. We make sure that people exercise, that they get a rehabilitation program. We look at their mental attitude. We're very keen on this. We oftentimes treat depression concomitantly with the pain.
Is from what you're saying, it seems to me that it's more about pain management than pain cure, correct?
Absolutely. We look at pain like we look at diabetes or Parkinson's disease. This is not something that we necessarily can cure, but something that we can treat so people can live a productive life. That's the main goal. In the end, we don't care so much about pain, we care about happiness.
Now, this is a show, of course, about aging issues, and as we age, we all feel aches and pains. Is that just a natural part of aging? Is it inevitable?
To some extent, yes. At 68, my joints are telling me that I am my age, the back begins to hurt. It's from dust to dust. The corollary to that is we have to accept some of the changes. But when it's enough to affect the day-to-day function, when it's taken away from the quality of life, from being able to play with the grandchildren or garden or continue to work, that's when it needs to be treated. And those are the patients we like. We like patients who are productive, and our job is to keep them so.
And I guess it sounds like that might be a way as we age to ease those aches and pains, correct?
Correct. One of the things that people forget is the importance of exercises. In our culture, we look more for a pill than other alternatives. Exercises, meditation, for some people praying, it doesn't matter, anything that works for you. But exercises are fundamental. We have found, after all the studies, there's no preventive treatment for pain that works as good as a regular exercise program.
Well, Dr. Schnapp, thank you very much for being on The Best Times and talking about chronic pain.
Thank you for having me.
For more information on chronic pain, search the website of the National Institutes of Health.